quick look at common injuries that we see in skiing and snowboarding. This is actually taken from a Scottish study, which I don't really understand why there's a Scottish study about skiing, but there is. So what they found, 33% of ski injuries are to the knees, where for snowboarders 25% are to wrists, and then we go down head injuries, and the numbers kind of drop off. But the two big ticket items, wrists and knees. And then if you actually look at the type of injury that's common, in skiers it's most likely a sprain, and for a snowboarder it's most likely a fracture. So if we think about it in terms of risk reduction, the likelihood that we're going to prevent a wrist fracture from training is pretty slim. If we're not going to, you can stabilize your wrist all you want. If you land on it, it's going to break. But the stronger you are and the better shape you are, the less likely you are to fall, catch an edge at the end of the day. So you're not going to be in the situation where you're going to break your wrist. For skiing, you get that same benefit. There's a secondary benefit though from skiing. The stronger your body is, the stronger your core is, the stronger your hip musculature is, the less likely that you're going to sprain your knee when you fall. So just, we're going to focus in on the knee. So in particular ACL injuries, because that's kind of the most common knee injury. So for those of you who have had an ACL injury, you probably know what the ACL is. It's the anterior cruciate ligament. This little thing right here. And it's such a tiny little thing, and it honestly doesn't even do very much. Like it doesn't actually, it's not an active ligament. It doesn't help you walk, it doesn't help you bend, extend, flex. It stabilizes. But it turns out stability is pretty important. So one of the ways that that turns into a sprain is if it's not unstable. So if you get too much movement of the femur relative to the tibia, or the other way around. So I'll just show you. So pretty much if your thigh moves and relative to your shin, or the other way around, you're going to end up with a potential for an ACL injury. Some of the contributors to this, if you have tight quads, if your quads are tight, just pulling on it, you can almost see that there's a relative movement here, right? So just by having too tight quads, you're already at an increased risk of injury. Having weak hamstrings also helps to increase your risk of injury. Weak glutes, that one's a little different, and I'm talking about specifically the glute medius. If you think about it, if you're skiing like this, your knee is collapsed inwards. If you land like this, your knee is in a really compromised position. But now if you have a strong glute medius, you're going to land like this. And now suddenly you're not in as much of a challenging position, you're less likely to have an injury. Now, so from a training perspective, what can we do about this? Well, for one thing, we can improve that quad tightness. So we can do that by rolling, and you'll actually see there's a specific exercise in the handout for rolling your quads. Stretching is, they've been doing it for thousands of years. There's a reason for that. And then pretty much everything that I said that was a contributor, fix that and you'll reduce your risk. So increase your hamstring strength, increase your glute strength, and you will be less likely to get an ACL tear. This is not going to prevent it entirely. Like skiing is a sport that has people fall, and we're not going to prevent that, but we will reduce the risk of a serious injury.